Welcome to Meet the Press Now. I'm Kristen Welker in Washington, where Robert F. Kennedy Jr. faced off with senators today in the first of two confirmation hearings to be HHS secretary. Lawmakers on both sides of the aisle pressed him on his well-established record as a vaccine skeptic and a pro-choice Democrat. Kennedy also fielded questions about his ability to lead HHS, a sprawling department of more than 80,000 employees and 13 divisions, including critical public health agencies like the CDC, FDA, NIH, Medicare, and Medicaid services. In his opening statement and throughout his testimony, Kennedy said he was not anti-vaccine, which led to some really testy exchanges with Senate Democrats who brought up his frequent past public statements expressing doubts about vaccine safety.
News reports have claimed that I'm anti-vaccine or anti-industry. I am neither. I am pro-safety, and I believe that that vaccines play a critical role in healthcare. All of my kids are vaccinated. I've written many books on vaccines. I support the measles vaccine. I support the polio vaccine. I will do nothing as HHS secretary that makes it difficult or discourages people from taking
Anybody
vaccines.
who believes that ought to look at the measles book you wrote saying parents have been misled into believing that measles is a deadly disease. That's not true.
Kennedy can kill off access to vaccines and make millions of dollars while he does it. Kids might die, but Robert Kennedy can keep cashing in.
Senator, I support vaccines. I support the childhood schedule. I will do that. The only thing I want is good science.
Now, Democrats also pressed him on some of his unsubstantiated claims about genetic engineering of diseases.
Mr. Kennedy, did you say that COVID-19 was a genetically engineered bioweapon that targets black and white people but spared Ashkenazi Jews and Chinese people?
I didn't say it was deliberately targeted. I just quoted an NIH-funded and NIH published study.
Did you say Lyme disease is a highly likely militarily engineered bioweapon?
I probably did say that.
Did you say that?
And that's what the developer of Lyme
I want all of
disease
our
said.
colleagues to hear it, Mr. Kennedy. I want them to hear it. You said yes. Did you say that exposure to pesticides causes children to become transgender?
No, I never said that.
Okay, I have the record that I'll give to the chairman, and he can make his judgment about what you said. Did you write in your book, and it's undeniable, that African AIDS is an entirely different disease from Western AIDS? Yes or no, Mr. Kennedy?
I'm not sure if I made that.
Okay, I'll give it to the chairman, Mr. Kennedy. It doesn't matter what you come here and say that isn't true, that's not reflective of what you really believe, that you haven't said over decade after decade after decade, because unlike other jobs we're confirming around this place, this is a job where it is life and death.
Now, senators on both sides of the aisle asked Kennedy about his past support for abortion rights, with Republicans securing a commitment that he will support President Trump's anti-abortion agenda, and Democrats pressing him about his sudden evolution on the issue.
I agree with President Trump that every abortion is a tragedy. I agree with him that we cannot be a moral nation if we have 1.2 million abortions a year. I agree with him that the states should control abortion. President Trump has told me that he wants to end late-term abortions, and he wants to protect conscience exemptions, and that he wants to end federal funding for abortions here or abroad. That's Title X. I serve at the pleasure of the president. I'm going to implement his policies.
You have clearly stated in the past that bodily autonomy is one of your core values. The question is, do you stand for that value or not? When was it that you decided to sell out the values you've had your whole life in order to be given power by President Trump?
Senator, I agree with President Trump that every abortion is a tragedy, that we can't be a moral authority in this country.
Right, but that isn't what you said back in New Hampshire in 2023. My question is exactly when did you decide to sell out your life's work and values to get this position?
Senator, I agree with President Trump that every abortion is a tragedy.
So what you're telling us, just to be clear, because my time is limited, is that regardless of what you believe, regardless of what values you have, if President Trump tells you to do something, you're going to do it.
Kennedy's testimony today comes as his cousin Caroline Kennedy is publicly urging lawmakers to reject his nomination, calling him a, quote, predator who preys on the desperation of families.
It's no surprise that he keeps birds of prey as pets, because Bobby himself is a predator. He's always been charismatic, able to attract others through the strength of his personality, his willingness to take risks and break the rules. I watch his younger brothers and cousins follow him down the path of drug addiction. Today, while he may encourage a younger generation to attend AA meetings, Bobby is addicted to attention and power. Bobby preys on the desperation of parents of sick children, vaccinating his own kids while building a following hypocritically discouraging other parents from vaccinating theirs.
Joining me now to break all of today's developments down is NBC News Chief Capitol Hill correspondent Ryan Nobles, NBC News senior reporter Brandy Zadrozny, NBC News health and medical reporter Berkeley Lovelace, and Dr. Amesh Adalja, senior scholar at Johns Hopkins Center for Health Security. Thanks to all of you for starting us off. Ryan, let me go to you first. You were there for all of the action, all of the drama that unfolded today. What do you think? I mean, we played a lot of really testy exchanges. What were the biggest takeaways for you today, Ryan?
Well, it certainly seemed, Kristen, that Robert F. Kennedy Jr. was trying to find a place where he wouldn't have to completely abandon his long-held beliefs and the controversial statements and positions that he's taken over the course of his years as a healthcare policy advocate, in positioning himself in a way that he doesn't completely abandon those positions, but finds it a way to put them in a context that's a little bit more comfortable for a small group of Senate Republicans that may be considering abandoning ship and standing up to Donald Trump on this. He certainly is creating a bit of revisionist history in the way he describes his efforts around vaccines, saying that he's never been anti-vaccine, that he just wants to look at the science behind it, when there's a clear record of him being very hostile to vaccines, questioning and being a true skeptic to them, up to the point where it's led certain communities to consider whether or not vaccine use is appropriate. But again, as we always talk in these confirmation hearings, there's probably a lot of Americans that watched the hearing that maybe thought it was a rocky performance and have a lot of questions about him being the next Health and Human Services Secretary. But it's not made for this group. It's made for that 5 or 6 House Republicans that may consider voting no. And I think while we played a lot of those highlights of the testy exchanges between Kennedy and senators, which I think are important, I think the most important exchange was between him and Bill Cassidy, the physician from Louisiana, who is a strong proponent of vaccines, who actually asked him some very pointed policy questions about how he's going to administer Medicare and Medicaid, the differences between the two programs. And Kennedy seemed to be a little bit lost about the specifics of that. And I think Cassidy's probably concerned about his ability to administer the responsibilities of being the Health and Human Services Secretary. And he's got to get to a place where he feels comfortable before he's ready to vote yes.
Ryan, let me follow up with you on that point. Do you have any reason to believe, because we know Pete Hegseth had a really uphill battle as well, and it hinged on one senator. How was Tom Tillis going to vote? Ultimately, he voted yes. Do you have any indication that at this point RFK Jr. does not have enough votes to get confirmed?
I think you need to start at a place of yes, they will get confirmed, and work your way back when it comes to these Trump nominees and the way that they interface with Senate Republicans. Senate Republicans have continued to follow a pattern throughout this confirmation process after Matt Gaetz exited the stage. They do a lot of talking behind the scenes. They raise questions. They raise concerns. They say that they're worried about these nominees. But when push comes to shove and they're forced to be held accountable, they almost all fall in line. Now, I could give you the names of 4, 5, maybe 6 Republican senators who I think have real reservations about Robert F. Kennedy Jr. I have a list of 0 right now of Senate Republicans who have come forward and said that they are definitive no votes. Could he potentially stumble tomorrow as well? and get into a point where he does not meet the threshold for confirmation, that is not out of the realm of possibility. But Kristen, at this point in the process, I still say it's very unlikely. He will probably become the next Secretary of Health and Human Services.
Yeah, I mean, the last point you make is the critical one, that so far no one is outwardly saying they're a no vote. It's such an important point to emphasize. Ryan, let me ask you, obviously, those statements by Caroline Kennedy got so much attention, publicly calling her cousin a predator. What's the reaction been there on Capitol Hill?
There really hasn't been a reaction, Kristen. You know, I think that Caroline Kennedy is a very famous person. The Kennedy family still holds a very important place in American history and in American culture. I think that's part of the reason that Bobby Kennedy finds himself in this position of being the next Health and Human Services Secretary. But again, this isn't a hearing designed to convince a wide range of Americans. It's a hearing designed to just convince 100 senators to vote yes or no on a nominee. And I think that group of senators that may be waffling are really not that concerned about Caroline Kennedy and her opinion of this situation. They know that the Kennedy family doesn't feel comfortable with Robert F. Kennedy Jr. in this position. It's really more about his policy positions and whether or not they think he's up to the job. All right.
Thank you so much, Ryan. Let me head over to Brandy now. So let's talk about some of what we heard in terms of his stance on vaccines. He's made a number of public statements expressing skepticism, and yet today he tried to convince everyone that, yes, he would support vaccines. What did you make of some of those exchanges, Brandy?
Today was a bizarro world. I've followed Kennedy for the last decade, and I've heard him make dozens and dozens, hundreds of statements maligning vaccines, saying that they caused widespread injury and death, saying that they're dangerous. He said in 2020 that he regretted getting his own children vaccinated. He said, if only I could take that back, I would do anything. I would pay anything to take it back. He believes that vaccines caused all of his children's allergies. He said in 2021, when Charlie Kirk asked him, if you had to do it today, would you get them vaccinated? He said, no, I would never get any kid vaccinated. Again in 2021, when he was on a Health Freedom podcast, they said, you know, what should we do about everybody? Nobody likes anti-vaxxers. And he said during the pandemic, our time to come out is now. And he said, quote, our job is to resist and to talk about it with everybody. If you're walking down the street, and I do this now myself, if I see somebody on a hiking trail carrying a little baby, I say to him, better not get him vaccinated. And he heard that from me. And if he hears it from 10 other people, maybe he won't do it. You know, maybe he will save that child. So to say that he's a vaccine skeptic is just not really representative of what he's said over the last 20 years. He is anti-vaccine. It may be uncomfortable when someone says, no, I'm not, but he is. There's no other way to go about it. And so, you know, he says that he's not today. It was a total reversal, not just on 1 or 2 vaccines, but he said today to Senator Warren, Senator, I support vaccines. I support the childhood schedule. I've never heard anything like that from Kennedy in the past. It's a complete reversal. And so the question is, you know, what his supporters were filling the room from the group Children's Health Defense. The executive director was there. There were followers and supporters there from Children's Health Defense and from other anti-vaccine groups. And when I reached out to them today and said, this is new. What do you think about this? It seems to me that they might know that he might not really mean it. Someone said to me, we know where he stands and we're not bothered by those comments. So
fascinating insight, Brandy. Thank you for that look back, which, as you say, you have been covering him so closely. So it's really critical to look back on those comments and those anecdotes that you shared. Berkeley, let me turn to you. What were some of your takeaways from the hearing today, particularly as it relates to how he might oversee this sprawling agency of HHS?
Yeah, so there were a lot of things that were unclear before that kind of were made a little bit more clear. So, for example, Kennedy made comments about bird flu, the bird flu crisis. Before, it was really unclear whether or not the Trump administration would devote resources to the bird flu crisis. And so Kennedy said that he would devote resources to the outbreak for that, as well as he would also support the Inflation Reduction Act's Medicare drug pricing negotiation provision as well. And so before, it was unclear whether or not they would support that. And then on top of that, I did notice he did seem to stumble a lot about health insurance and Medicaid. So on Medicaid, he did say that a lot of people don't support Medicaid, or people who don't like coverage don't support it, although polling suggests that a lot of people, actually an overwhelmingly majority of Americans, do like Medicaid. He also kind of fumbled a bit about the specifics of it. He said people on Medicaid have too high of premiums, but although people on Medicaid don't pay premiums, I'm thinking he probably meant referring to Medicare as well. He also said people don't like the Obamacare premiums as well. And so it's a little bit more clear on his regards to stances on health insurance, but he did seem to stumble a bit about it.
And we had a little trouble with your mic. We got it fixed. Thank you for hanging in there through that, powering through it. What did we learn about his stance on health care costs today? Because obviously that's been such a big focus, a big topic of conversation. The Affordable Care Act, should it be repealed and replaced? What did you think we learned?
It's a mixed bag. I think the biggest news was that the Trump administration supports the Inflation Reduction Act Medicare drug pricing negotiation provision, and so there's a little bit unclear whether or not they would support that and whether or not they would try to repeal it, similar to Trump's stance on the Affordable Care Act. And so they did say they support that, and right now they're in ongoing negotiations with it. They're currently negotiating 15 drugs on that as well. He did seem to side with Trump on Obamacare. He said that Obamacare is increasingly unpopular, which polling suggests that's not true at all, that people do like their Obamacare coverage. So we could see in this incoming administration, if Kennedy is confirmed, him trying to move to try to weaken that law, which is something similar to happen in the first Trump administration. So there are some concerns there. And of course, there are ongoing lawsuits as well to try to get certain provisions as well removed for ACA.
Well, it's a really important perspective. And when I interviewed President Trump, he basically said, if I can replace Obamacare with something better, he would be open to that. But to your point, public polling shows how popular it is. A lot of Republicans say it's not realistic. Berkeley, thank you so much for being here. Really appreciate it. Dr. Adalja, let me turn to you now as a doctor and as a public health expert. What were your key takeaways from today's hearing?
He's basically trying to rewrite reality and try and make his views more palatable, that he's just a vaccine skeptic that just wants more safety data, when that's not been his record. This is a person who said he wanted to erect a statue to the person who debunked the person that linked autism with vaccines. He wanted to have an Andrew Wakefield statue erected. So this isn't something that anybody should believe. I think this is just him wanting to get confirmed. And he really is what I would call a destroyer of health. He's got this nihilistic fixed idea that vaccines are harmful, and I think it would be a disaster for him to be in charge of HHS. And I wasn't convinced of any of this, and I think nobody should be convinced. This is just someone trying to get into a position of power to create more chaos and destruction.
You know, I'm curious what you make about his comments when he was pressed on COVID. He said that the U.S. had worse outcomes of COVID than other countries because of chronic disease and food quality. Can you just give us the fact check on that? Is there any credence to that? What do you make of that?
Certainly, COVID-19 synergizes with diseases like diabetes, hypertension, and obesity. And the U.S. does have a problem with all three of those conditions. And that does make COVID-19 worse. And that's part of the reason why we had worse outcomes in other countries that don't have as much of that. But a lot of our outcomes had to do with mismanagement from the government from the very beginning. Basically, there was evasion by the Trump administration for January, February, half of March before they started to do things, and they started doing the wrong things. And that's why we had such bad outcomes. But yes, it definitely did synergize. But I don't think that RFK Jr. is someone that's going to guide us out of these chronic disease epidemics that we have, because he doesn't even believe in the scientific method, and it's only science that's going to solve these problems, not his platitudes.
So, Dr. Adalja, he obviously one of the biggest questions is what we've been talking about throughout this segment, his views on vaccines. He says he'll stick to the science, just as you're saying, when it comes to vaccines. What should people take from that, given his past statements in which he's clearly tried to link vaccines with autism, which, again, study after study shows there is no link?
He is an unprincipled person that's basically lying. I think there's no other way to put it, that he's lying about his past statements. He's lying about what he's tried to do for vaccines. I think that people should just dismiss it. This isn't the Robert Kennedy that we've seen for the last several decades. This isn't the Robert Kennedy who's made millions of dollars with the anti-vaccine movement. This is a totally different person who wants to be confirmed and is trying to say something that will sway some senators that might be on the fence about voting for him to think it's okay to vote for him. But nobody should be fooled. This is a destroyer. This is someone who is against one of the technologies that humans have invented that have allowed us to flourish, that have added decades to all of our lives and saved hundreds of millions of people. He is against that. If you're against that, you cannot be, a good person at heart. You are what Carolyn Kennedy said, a predator if you are going to be against a life-giving technology like vaccines.
Let me ask you, broadly speaking, about a slightly different matter, which is that President Trump last week ended cooperation between the CDC and the WHO, the World Health Organization. What are the potential implications of that here, but also globally?
The biggest implication is that the U.S. will get information on a lag. We won't have situational awareness of infectious disease emergencies that are occurring all over the world. People report their outbreaks to the WHO, not to the CDC. So if we're trying to be resilient in the United States to infectious disease outbreaks, we have to be part of the WHO. And while there definitely are reforms that need to happen at the WHO, there's no way that those are going to happen unless the U.S. is at the table. So I think this is the wrong decision, and it makes us less safe, and it only increases the chances of infectious disease outbreaks spiraling out of control if the U.S. is not part of this.
All right, Dr. Amesh Adalja, thank you so much for your insights. We do really appreciate it.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app or follow us on social media.